Ugbede, a commercial director at Swift Manufacturing Organization. Back to you.
I see a lot of people that are doing a lot to making sure that the pharmaceutical landscape of Nigeria is changed positively. So we invest in quality from WHO pre-qualification, as you are aware. In the last 2-3 years, a lot is happening in that space. But away from SWIFA, there are other companies in Nigeria that are investing massively, and you see that we have capability building in the provision of biovaccines in Nigeria. There are conversations ongoing. People are making those investments in this field to make sure that we have biovaccine capability in Nigeria. Away from that, other companies are building cephalosporin standalone plants in making sure that this essential medicine for the healthcare of Nigeria is provided. Against all of this, when there are problems in the distribution from a supply chain perspective, you can understand the problem that it poses to the health of the population in Nigeria. So if we look at the first slide from the keynote speaker, you see what's happening in the US, the big three responsible for as much as 95% of the pharma distribution chain in the US. But again, when you look at Amerisource, a lot is also happening to Amerisource in the last 2-3 years. Started in 1871 by Napoleon, and just to say that it was a family business at the time. But when the business was growing beyond the family, a lot began to happen. It meant that from the outset, the thought was more to grow a business that was going to be more than even the family, and Napoleon that set this business in 1871. So 2012, 2011, and 2015, there were lots of acquisitions that happened. They were also thinking global to increase the footprint beyond US. So just to say that Alliance Healthcare in UK was acquired by Amerisource, and by that acquisition in 2021, by 2023, Amerisource has changed, transitioned to Sensora. They are now Sensora in US and responsible for up to 20% of the market share of pharma distribution in US. So why am I saying this? It is to say that in the closing slides, where the keynote speaker has spoken to mergers and acquisition, the need for it and all in Nigeria, the time for me, in my view, is now. Because from a manufacturing perspective, do we have one manufacturer in Nigeria that is able to manufacture all the medicines need of Nigeria from one facility, from one factory? The answer is no. But if we were to be able to aggregate all the needs from a pharmaceutical perspective with a mega wholesaler, where the retailer, where the hospitals can be able to go source for their products under one roof, it helps a great deal to make sourcing for pharmaceutical an easy one for them. So yes, pharmaceutical wholesalers, the problem that you are trying to solve today, if you look deep down, you would understand that it's a problem that has been here for over 40 years. And the time to think of what to do and the speed to do all those also will help in accelerating the course that you are all here for. Thank you.
Yeah, thank you very much. Can we appreciate him? He's made his contribution from the perspective of manufacturer. We want to ensure that their quality medicine, the supply chain, it's not compromised to the detriment of the quality product they have produced. So it's wholesalers play a vital role in ensuring this. I'll go on to my sister, Mrs. Abdulaziz Adenike, MD.
Thank you very much, my chairman. Would you permit me please to stand? Before I start, I'm dropping 4 envelopes here. Each of these envelopes contain different sums of money. And the question I'm going to ask, please, the question I'm going to ask, I want anyone who is less than 10 years post-qualification. But if we don't have, I'll take less than 20 years. Above 20 years, please don't attempt. Good morning. A young man met a young lady in school, different parts of the country. And of course, they fell in love. School over, NYSC calling. We need to do something about this relationship. The young girl is from Yoruba land. The young man is from Zaria. There's a need to bring 2 families together so that another new family can be formed. It is the tradition of our people that you get a middleman who is going to bring together the 2 families. The person is going to act as a middleman. The success or otherwise of that journey depends really on the chosen middleman, not on the lady or the man or both parents, because it is what he presents to either side that would make them take a decision for or against that union, right? So that middleman, I want what it is called in Yoruba and what it is called in Hausa. Daddy, you are more than 20 years in the profession. I said less than Abba. Yes, the lady at the back in red. You raised your hand and then you quickly brought it down. Yes, ma'am. Alarino, beautiful. Can you please come forward? A round of applause for her. Come forward quickly. So who can tell me what it is called? Are you? Yes, you look young, less than 20 years. Get up. What's it called in Hausa? Medelili Hauri. So what is Wakili? Okay, good. Another round of applause. Now, 2 of you, please don't sit. So look well and pick what you want.
Interesting. Oh God have mercy.
Thank you very much. You can open your envelope and the content is yours. Now, to what I'm here to do. It has something to do with this story. Whatever is there is yours, don't worry.
Can I pack the remaining one?
Sorry, is this working?
Let me pick mine.
Is this working? Yeah? Oh, are you controlling from above? Okay, all right. I'll tell you that story. No matter how good a manufacturer is, no matter how good the product is, if it does not get to the patient at the same quality it left the factory or very close to, the aim of the manufacturer is defeated. If it does not get to the patient at the quality where it will remain efficacious and safe, even the aim of the doctor who prescribed it is defeated. The aim of the patient who also went to the hospital, got a prescription and went to purchase the drug is defeated because it doesn't get cured. And who can defeat all this? It is that middleman. The man who stands in between the manufacturer at one end, the chain to the retailer, and finally to the patient. Who are these middlemen? We are the wholesalers. We determine a lot of what happens to your product. We determine a lot of what happens to your product. But many of you do not know us. You do not know what we stand for. Many of you see us as traders, but are we really traders? The pharmaceutical wholesaler, we store, we distribute, we sell medicines and devices to other wholesale pharmacies or community pharmacies, institutional pharmacies or other persons who are authorized by the law. That's our legal definition, but let me tell you what we really do. We are the people who add value at all times in the time and space it takes between a product leaving the manufacturer and getting to the user. Yes, we're middlemen, but we're also caretakers. Because the wholesaler that does not take care of this product does not give you the quality you want at the end of the day. Good wholesale practice and good distribution practice is our stuff. That is what we really offer. We are bulk breakers. How many retailers can afford to pick a carton of Tuxil N, a carton of Cofarest, a carton of Kofta, a carton of Coughlin? Most of you can't. But we break the bulk for you. We allow you to use the money for one carton to pick 6 different varieties of medication in a group. So we are bulk breakers. Yes, we provide variety. By this, I don't mean bulk breakers. I'm telling you that you need cefuroxime. We can give you 6-10 brands of cefuroxime from our shelves. Different price ranges. Good efficacious products that you can assess your patient, and if they can't afford one, you have alternatives to offer. Isn't it? Yes, we are your financiers. I say it very boldly. I know a lot of retailers who get money to rent shops, get money to put shelves, and then they are back at our doorsteps asking us to give them stock on load. We are your financiers. That's who we are. Most people do not recognize us for what we do. So, professional pharmaceutical wholesalers. We are the professionals that balance financial concentration with professional focus. We're different from the traders in the open market. We ensure that the patient has access to quality and affordable medicines. And we add quality continually during the phase of transportation of products from manufacturer down to the retailer or hospital that will hand it over to the patients. So, like he said, our topic has only 2 prongs. My keynote address speaker has said it. The wholesaler on one hand, quality assured medicine on the other hand. And we all know that lack of access to quality medicine is the leading cause of avoidable morbidity, mortality, and drug resistance. And access to quality assured medicine is crucial for health. So what are the 2 things we're talking about this product? We're talking of efficacy and we're talking of safety. That's the word I've been trying to look for. We've been talking about the efficacy of products. There are products that, when they are stored at the wrong condition, wrong temperature, packed together, this and that, they don't only lose their efficacy. What about products whose breakdown products are actually toxic to the system? Are they safe to be taken? I remember that when we were in school, they taught us about LD50. Products whose efficacy and the toxic dose are actually quite close, and they have to be closely monitored. I don't know if any of you have been inside the Dumota or Headbridge Market, and you will tell me the products you can see there that you can post and say this will be efficacious or this will be safe. For Pildan, what we do is we have come together. The chairman of the association mentioned it at the beginning. Because we saw a lapse, there was a gap. Distribution is chaotic, but we need to do something about it. Individuals sprung up and started their own wholesale pharmacy. The likes in those days, we used to hear of Epic, Nemit, and then people like New Heights, Farmfort, and then NHC and Co came up. Funket had always been there for a long while. Mama Santos, trying in our own little way. to ensure that we provide an alternative. See, the truth is there's no vacuum in nature. And unless you provide an alternative where people can source products that they are sure will remain efficacious and safe, they will run back to the market. My organization, for example, is not owned by one man. 20 years ago, 8 young pharmacists came together. They all owned their own retail pharmacies. But they pulled resources together and got a professional manager to manage it and set up a wholesale outlet. That's Pharmford Network. That's why it's a network. It's a network of pharmacists, all pharmacists owned. And of course, managed by my humble self now. This is what we are talking about. As pharmacists, we must provide viable alternative because nature abhors vacuum. Powder members adhere strictly to a code of conduct. We operate under high level of quality, and though not all of us are at the same level, but we are trying to pull ourselves together and help ourselves up to get to where we should be. Powder self-regulates. What do we mean by this? We have standard SOPs that we share with members. This is how we should go about it. And we do that on a regular basis. Now, since almost all wholesalers sell the same type of products, I'm not talking of those in the market, I'm talking of PUDA, regulated wholesalers. We are so professional that we do not compete on the basis of price. That is where we differ. You get to the market, how much is that quantum to you? 2, 3. No worry, come my shop, I will give you for 2, 1. But you're not even sure of what you're getting. With PUDA, we're so professional about it that we take marked percentages. So what's the difference in what we offer you? Is customer service and customer relationship. But we make sure that we're offering you the same things in terms of quality and safety of products. What we also do, we strengthen our personnel. Every year, Powder holds a conference. And as part of that conference, we pull our key staffs together and get people to also train them. So we're not just improving ourselves, we're also improving our personnel, training them to ensure that if you take the right decision to stop with registered PUDA member, the service you're going to get is going to be second to none. In addition to that, we also know that there's need to invest. We have to increase our infrastructure layouts. NAFDAC has done wonderfully well. Initially, I thought they were doing us bad. When they started inspections with us, I think they went to New Height, Nemit, and myself first. We were the 3 they first eat with it. And they're asking for this and asking for that temperature mapping of your premises, this, that, how your... It took us weeks, but finally, as the time went on, we were able to meet their standards. And coincidentally, I was talking to somebody one day, and the person was telling me, I'm going to look for Pharmford. And I said, what for? I didn't tell her I was Pharmford. I said, well, NAFDAC came to their place and they said, you don't have to be very big to comply. Go and see what Pharmford is doing. The lady didn't know how glad that comment made me. But the truth is that in our own little corners, we're trying to improve and put infrastructures in place. And as a group, we're also banking with certain banks that we'll be talking to them on how they can finance the expansion of members such that we'll grow together. And of course, I always come back to what you benefit from us. PUDA members, we're assisting pharmacies in simplifying your everyday task. We're employing technology to ensure that you operate better. We say send your list, just click on our link on our website. Use WhatsApp and send it to us, this and that. We delete the ones we've given you. If you have leftover, we send it back to you. Every day, we are trying to make your operation better and faster. But while we do all this, there are bulls in the China shops that we are not addressing. I have several of them. Let me talk of one. Profiteering. We all know what profiteering is. We were all around when Sinat, Ampiclox and Co. went out of stock because of the exit of GSK from Nigeria. And what happened when it came back? A pack of Ampiclos was going for 50K. A pack of Sinat was going for 25K. Was that the price it came out of the company? How did we get to that point to make essential drugs unaffordable to the masses? Let's start thinking. Profiteering is something that distorts market prices and turns medicines to ordinary trading unethical marketing. This is addressing wholesalers. So how about the manufacturers and company representatives that market unethically? A company has a product expiring in 2 months' time. And then there's a product that's been out of stock for a while, everybody's looking for. They tell you that before you can buy this, you must take the one expiring in 2 months' time. How ethical is it for you as a distribution organization to push out products that would expire in 2 months? A volume you know that the community you exist in or the country as a whole cannot consume. How ethical? And yet nobody talks about it because they are big, because we're mega distributors.
Wow.
Well, I have thank you. I have 2 minutes left, so let's look at this. This is a wholesaler's premise. You can see how the products are arranged, spacing between them. If there's AC, it will, well. Now look at the other side. This is actually a picture of a shop in Idumota. Some drugs in nylon, in black nylon. Can you see that? Others in cartons, all stacked on one another. And then when you get there, you want it. Don't worry, they know what is in each of those cartons. They will get it for you. But in what state? As against the one that is properly laid out. Okay, let's look at your own shelf. You bought from here, the first picture, and then you went to arrange it like this. So who enters here says, this product must be efficacious and safe, it's of good quality. There's a question for all of us. The degradation that has occurred in the shop before you bought it, is it reversible? So why would you do that to yourself? I asked 2 people to come and pick envelope here. This person looked. I was taught to pick the one on my side. The other person looked. Why did the 2 of them hesitate before they picked? That's the question here this afternoon. They hesitated because they wanted maximum value. Nobody knew what was there. But you wanted to be lucky enough to pick the one with the higher number. The truth, all the envelopes contain the same amount. I only wanted to display the fact that each of us always looks for maximum value in what we have access to. So why will you not offer products of maximum value to your patients by ensuring that you buy from the right source? Finally, how do you engage your pharma wholesalers? The first thing when a retailer wants to talk to you is they want to ask you for credit. How much credit facility are you giving me? As if all the wholesaler exists for is for credit. No, we are much more than that. What are the things you can discuss? Your free options. What is the return policy of this company? Alternative brands. What alternative brands do you have to? This product that is scarce or this product that is expensive? What are my storage options? I give you an example. We have some customers who don't have proper refrigeration system in their retail pharmacies. We don't break open packs. Somebody buys a pack of Novo Mix Flex pen which has 5 pens and he doesn't have how to store it and he can't sell the 5 in a day. We simply have what we call customer tags. You take the single one you need for your patient, we tag the remaining 4 with your name and still store it for you. Can you get that in the open market? Open market, where you go, they go even tell you, say, Madam, a hot one you want, a big cold one, at different prices. It's only builder that can offer you that. You can ask them for suggestions on fast-moving products and product trends in the industry. A builder member will offer you very valuable information on all these things. Of course, you can discuss your staff issues. because we're going through it ourselves. We can share ideas with you. You can even discuss your personal issue. Sometimes, yes, sometimes what you need is somebody to just share your mind with. So, pharmaceutical wholesalers and retailers, we should be partners, not just customers. The truth is that where you stock what you stock determines the outcome of a lot of work. So, for your peace of mind, find the builder member in your vicinity or one that you can work with, because distance is no longer a barrier. Thank you for your time.
Wow, very nice presentation.
His paper, and clearly he demonstrated that in the developed countries there is concentration of the universe or the number of people who engage in wholesaling or wholesalers and drug distribution. And with that system, you know the players, they have economies of scale. They can negotiate good prices, and people, you can trust where you are buying because there are just few of them. In those places, about 90% of the drug distribution is accounted for by just less than 10 distributors in those places. With a very good IT tool, we have AI now. When they see your sellout, it can pick your sellout rate and flag when you should reorder, what quantity you should reorder. You can have, arrangement for just-in-time deliveries, so that you don't need to keep heavy inventory, because inventory is money. It's about your working capital and all that. So those are the things to look at. Logistics, you mentioned that. Quality assurance, you also mentioned that. And I think this is one area that probably, I don't know what it is now, but I think within PUDA, there's a need to have a systematic approach of driving quality assurance. In quality assurance, some people regularly know that you have different levels of audit. Level 1, level 2, level 3, level 4, right? You need internal or builder-wide process where you can do peer audits. You have processes in place before the auditor comes from outside. You yourself, you've done your level 1. Your level 1 is within your organization. All those things that are quality related. You have checklists, you have people trained in-house who can do that for you. You have level 2. That means maybe within your organization, another person within your group. It needs to be structured. Some people have, they've gone far in that process. Some have no clues. So, to build PUDA to be quality driven, I think within the PUDA structure, mirror like what some other people do. There's a quality department here. There's a quality department or a quality unit that helps to drive this process so that everybody, at least, you can do some rating among yourself. I know this is tier 1, tier 2, tier 3, tier 4 people amongst you. So it's very important. And that dovetails into regulatory compliance, progress in identifying the regulated products. I think if you adopt a good IT solution, this e-catalog, so to put it, both the one you stock and the one everybody stock that are licensed can be readily available on the digital platform. I also talked about digital transformation, and I think this is long overdue. We talk about supply finance. If you have a digital platform, it will attract investment. People see what is going on there. It's not about you just open your books. They'll see it, and they can readily finance your operation. Of course, there are a lot of challenges listed, but those challenges equally represent opportunities. Those include medicine supply inefficiencies, prevalence of counterfeits, high infrastructure costs, and all the rest, limited access to finance, low technology adoption. Those are the things mentioned by the lead speaker and the preferred solutions to how we can go about it. Those solutions include you have a product database, build-wide. You have a central catalog. You have a pharmacy-specific ERP. There are quite a number of things that are actionable here, and this is not just to be a talk show. I believe that we take cues from some of the things that we mentioned. For the industry, they produce quality products. They want assurance that when it passes through the supply chain, that quality is not compromised. So they invest a lot in their supply chain as well. For our Builder member, Madam, you can see she was very passionate. Builder, the cornerstone is to ensure efficacy and safety, be the intermediary between the manufacturers, importers, to healthcare providers and the patients. And they do a lot of value addition in the process of delivering that. So those are the things that I was able to capture. I think there are quite a number of things that we can reflect on. But then let's hear from the audience, about 2-3 people to make contribution. Questions or answers, questions or comments. We need, how many people? Let me see so that we can determine.
I think I heard ma'am. I think I am relevant to India's chain of pharmacy and the distribution channels. I relevant same problem in India, and I would like to add one point. While here there is a demand supply gap, where there is no any idea as a manufacturer, if I want to export here, what are the products I should export and what are the requirement is lacking. Because we want to supply, but there is no clear guidelines. Maybe your company and his group will guide us well what are the products we can export, and we are also planning to establish our factory in Nigeria. So to supply, lead time would be, them says only 6 days, expiry date. If we fulfill that, I think we love to be here, and also we are planning very soon in Nigeria because of to lead time. To reduce the lead time and to give a better quality and a faster service, delivery service. So that was our production. And yes, I'm happy that I'm here. We participate here. We have B20 store. I think we invite all people to visit our store B20. Thank you.
Okay, we just take the questions, then we direct them to the.
Good afternoon, great audience. The topic today I'm listening is very exciting. I think one of the biggest chaos in pharmacy profession is the drug distribution. And all the manufacturers have actually touched it. So excellent. I want to commend Mainland, the Association of Nigeria, for the great job they're doing. One of the things I would like to add, creating a presentation, and most of the presentations that were made today, one of the missing links for me was the lack of discussing profitability and sustainability. It's good enough to be a pharmacist and be passionate, but you have families and school fees and all that to pay. And when I think about all the presentation, I've not heard anything about the business plan. If supposing today I would like to go and become a member of Freedom, how much will it take me to be part of that group? Because Chris, you mentioned that there's a need to expand that ecosystem. But I also like to suggest that it's important to look at the whole value chain. It's okay to look at the manufacturers, it's okay to look at the wholesalers, but then if you miss regulating the last mile, the whole effort there can become frustrated. So therefore, so I'm not giving another lecture, I think there's a need to think about a business plan. that will allow an aspiring member of PWEDA to be profitable and sustainable. That would mean a sort of chain, a sort of promoting people that can advance into that mix. It could be successful pharmacy retailers or pharmaceutical outlets. They can move in that chain. After all, like Madam, you said, people start from kindergarten to primary school, to secondary school, to universities, and so forth. So you need to look at the whole of that chain. And therefore, when you make that presentation, you should be able to say that if you are a pharmacy outlet, first of all, you know, one of the questions that has not been asked in this country is that the average pharmacy outlet, how is that person surviving? How is that business surviving? Is that person surviving enough? Why is the ecosystem in this discussion today? You don't have a banker, you don't have any microfinance people engaged in this discussion because there's so much money in this business. We need to tie in all that. Therefore, a business model that will allow an aspiring pharmacy guy to run a profitable business. And then the guy will say, okay, how much will it take? Therefore, how much financing do I need? If I want to move from pharmacy to become a wholesaler, how much will it take? What are the parameters? It's okay to talk about what PWEDA is doing and the role and responsibility, but you need to deliberate on how that expansion can happen, what kind of territory demarcation do you need to ensure. It's a whole project. And then what kind of roles and responsibilities will you expect PWEDA for such aspiring member, and what will be his own role and responsibility? When you tie in all that, then of course the future will be brighter. Thank you.
Okay, thank you for your comment. Let's take.
This is an interesting discourse, really. But coming from the last speaker, I think to expand the distribution chain to make it more efficient, to attract more investment, I think we need to look at what happened to the banking sector. You know, several years back, you have many small banks. They were claiming that, you know, but then the regulator CBN came up with a regulation that, okay, the minimum investment should be this, and it shook the banking sector, and then the sector became better from this. The number of banks actually reduced from over 100 to just about 40 something, but more investment came in, and there was more resilient. There was more trust in the sector. I believe the same thing can be done to the pharmaceutical distribution system, and it has to come from the regulators. Just like the keynote speaker mentioned, that there is need to set up a benchmark to increase it. You know, because looking at it, when we say 70 square meters, better, right? You know, most of these people, they are actually not interested in wholesale. They are more interested in retail. But they just use that license, you know, as a cover-up to retail. So, but if the regulator, if they can increase the standard that, okay, this is the minimum capital requirement, this is the size, this is the standard, and that is maintained, it will bring out business models that we have been talking about, that collaboration. You know, I mean, this my young friend was telling me that he wants to raise his retail to wholesale, and I told him that, well, you know, it's good, but then you cannot do it alone. If you really want to do something reasonable, you have to collaborate. You have to get more people with like mind to come together and form a bigger business. You know, so but if that standard is not raised by the regulators, everybody will want to just be in his own corner doing the small things, and that will affect the whole system in the long run. Thank you.
Thank you.
I love the conversation on the quality, the internal audit, and developing the quality control systems within your organization. My question is very simple. To become a member of PWDAN, you have certain criteria. Are you able to offer members who want to, companies that want to become members of PWDAN, are you offering them support to be able to initiate quality control in the stages that you mentioned on training staff to do the basic number 1 internal audit, maybe the number 2 internal audit, and then develop to a level which will be acceptable to the international pharmaceutical organizations. To include that perhaps in the PWDAN membership option might also help to raise the standard globally throughout the system. That's my question. Thank you.
Thank you.
Just to portray the aspect of the size of a premise and the financial capital, probably we can start bounding some numbers so I can sway the discussions. The size of not less than 150 square meter and the financial capital not less than 500 million naira in today's Nigerian economy can start a discussion for those who are serious players in this wholesale distribution. Then two, for Pharma West, I have this program because many PWDAN members,
60 seconds.
Yes, you have contract with manufacturers when you take 2%, 5% per annum turnover as sales incentives. But I don't know of PWDAN members that pass this incentive down to retailers, because these loyalty programs can help their retailers to make them faithful to you. If you, for example, a retailer buys about 100 million naira annual turnover from you, do you have schemes that give loyalty remuneration to at least keep these retailers within your belt and so that they can be very loyal to you? Thank you.
So I have 2 questions basically, and then
60 seconds.
All right. So what are the incentives for financing this sector, and what are the efforts PWDAN is making towards that? And funny, I just actually discovered what PWDAN was about yesterday when we went to their stand, and I think PWDAN needs more publicity. So the next question for me is, what lessons has PWDAN learned from the open market? Because we know they did a lot of things wrong, but they also did some things right for them to have 80% of the market with them. So what lessons can PWDAN learn from the open market? Those are my questions.
A plea and a commitment from the organizer of this forum, Chief Yakasai. That's for you. At the inauguration and the first panel we held, this issue came up, and I believe that any discussion like this that is not actionable becomes an academic exercise. The president of Healthcare Federation, who doubles as CEO of Pharma West, we need a commitment from you too. One is that if we talk all this without action, it will go back to square one. We have set the pace, we have taken your feedback, but the major thing which has been recurring is if the regulators are not doing what they're supposed to do, there's nothing we can do about it. I normally tell them that PWDAN is being fed by the same mother with the open market. And nobody has talked about what is the position of the manufacturers in all this. Because I know about cancer cell. If you don't feed the cancer cell, it will die naturally. You have talked about 80% of the turnover. I don't know how you get that statistics, because a few years ago we were in Senegal and analytics of turnover of different countries in pharma was being mentioned, and he came to Nigeria and he would dash. And I was asking, he said no data. Because you cannot get data in the open market, definitely. But we are a data-driven organization, ready to share information. What I want you to do, please, is about the advocacy. If you want us to adopt you as our life patron or mentor, please we do. So that we'll be able to have a roundtable discussion about all this. There's no need in stopping ourselves every time we come with the methods. That's the much I can say. Because at any given time, we are the low-hanging fruit in the distribution chain, whereas there are a lot of leakages. If you don't get it right from the foundation, the rest cannot follow in line, definitely.
Thank you very much. Let's appreciate the regulatory requirements. I think you will take that. There was contribution on profitability.
One of the questions he said is that somebody from another country wants to bring products into Nigeria and wants to work with Buda. I think this man has just simply highlighted what this conference aims to achieve. A round of applause for Pharma West Africa. The essence of this is actually to bring people like you together with people like us. And that's why we spent the first 1 hour this morning for an opportunity for us to relate. So any member of Buda you pick, you can talk to them. There's vast resources online. You can get the NAFDAC green pages. You know the products that are registered already. You have the contact of a member of Buda. Work together with that person, and I'm sure in a short while your products will be in Nigeria. Somebody asked a question that the incentives that they give to wholesalers, do we share it with our customers? I think the very first person that was on the system, Benados can bear a witness. At Fanford Network Limited, for people who do reasonable volume for us per annum, they get a credit note at the end of every year, which they can use to purchase anything to their shop. It's a company policy with us. Somebody at the end there asked a question about what lessons has Buda learned from the open market. We've learned a lot. It is true that there's nothing bad that does not have a good aspect and nothing good that does a bad aspect. You will not believe it, but currently there's a lot of collaboration amongst members of PADA in terms of making bulk purchases from company. You see a container landing in Lagos, you think it belongs to Chinedu. No. Laide, Chinedu, Olaiya, and Ahmed, all of them own that container together. And that's how come they're able to get cheap price. Right now, Buda, we're not only buying through individual collaborations, we're even having regional collaborations. The West, members in the West coming together, making bulk purchase. Lagos, North, Port Harcourt, and all that. We learned from them. That's one of the things. Unfortunately, we don't have enough time to take it on. Thank you.
A strong BWDN is an opportunity, not just for us as manufacturers, but for the entire value chain. Our business is not to ever invest in strengthening supply chain logistics for products. As much as I have emphasized the need on emphasis on quality, we need a strong BWDN to have a better partner, and not from a transactional perspective that it is today. I know that most of the members here are our customer. If I use my companies, BIFA for instance, they are our customer. And if I look at the analysis of trends in the last 3-4 years, some of these companies have grown strongly to the extent that the companies now putting investment in training, in terms of training on supply chain inventory inventory management and all. We're sponsoring speakers that we pay honorarium to be able to deliver some of this training to some of your members, and we would continue to do that because it is our aspiration to see a strong association here that can be the off-taker, whether you talk of full line off-take or off-take of particular portfolios. And what I would say as a last is that we see investment, like I mentioned in BioVaccine, who is the member that is also scaling up investment because BioVaccine will require specialized storage, temperature, and all of that. Who is investing to be that desired partner for that organization when they are ready to roll out those products from the lines to the market? Think about it. And the need for measure, the need to have strong presence at regional level is key to the entire healthcare system in Nigeria. Thank you.
Thank you.
I will talk about what Gava mentioned, the issue of size and capital requirements. I think this is very important. I know the enforcement will be done by the regulator, but I think PIDA should lead the way to say, okay, for you to make a suggestion, Somebody said about 150 square meters in terms of size, 500 million in terms of capital. May be right, may not be right, but I think we must have that benchmark. Let it not just be we set a 70 square meter, otherwise this chaos will never go. It will continue to be there. We need to set minimum requirement. People must have scale. That basically takes me to what Inus are talking about, profitability and sustainability. We've had cases where people, sometimes 2 or 3 years ago, somebody was retiring from where he was working. I had 5 million naira. I came to me and said, I want to start a retail pharmacy. How much do you have? 5 million naira. I said, 5 million naira. Is it to pay rent or to register or to buy or to push shelves? But that's all he had. Well, I didn't know. I didn't see the person for a long time. Eventually, he started and he closed door because he didn't have the full implication of what is there. Sometimes we think, when you see people, you think people are doing well, you think, oh, if they can do it, I can also do it. 5 million naira will not help you to start a retail pharmacy. But what I'm saying is, we must have capital requirement and size, and the PIDA can advise government, but the government needs to enforce it. 70 square meter doesn't cut it. Now you asked about 80%, where I got the figure from. That was what I just exactly the figure now that release. Because they said they were seizing about 100 trucks of medicines, and that 100 trucks was worth by 1 trillion naira. And 100 billion of that have been destroyed already. And I'm saying if we here now have 100 billion and put in our business, we have it will be a renewed agenda. We will have some fresh breath of air. So and in closing note, I want to say, please, Peter, you need to expand your member scope. Look at what is happening right now. I think look at beauty company like CeraVe and Eucerin. I think they are going through the pharmacy routes to get their products to get the products to the consumer. And I also believe that if we are doing our own professionally, most of these guys coming in want to go through our route. You don't want to go to the open market. You want to go to the route that we have. But we need to have scale. We need to have capacity. We need to have the volume so that they can go through our route to make sure the products get straight to the final consumer. Thank you very much.
Just to reintroduce myself, I'm Unjidendili. I'm the country director for Farm Access Foundation and the president of Healthcare Federation of Nigeria. So I just wanted to address what you said. Yes, please adopt me as your patron, but it's important, Healthcare Federation, for those who have been following, and I mentioned it before on day one, that our sole aim is advocacy to policymakers. Advocacy. So we're talking to NAFDAC, you name it, we're talking to all the policymakers. So it's important that we align, because when different associations are, approaching them, sometimes they respond to one, they may not respond to the other. But if we come together, I think we have a much greater impact. In fact, 2 weeks ago, I was in a meeting with the manufacturers, pharmaceutical manufacturers, together with the World Bank IFC leads. And I was surprised when they were making their presentation, they were talking about issues that they identified. And I said, we've already done this in HFN. We've engaged the DG NAFDAC. So why are we approaching them differently? If we come together, I think that we can have a much greater impact. So please, I think this is an opportunity. This is my first time in your meeting that we align. I've also been speaking to your chairman. We've agreed that we'll have a session and then we will find a way to align what the problems are and attack them together. Second thing is from the Farm Access side, because Farm Access has a medical credit fund. So like mentioned on day one, it's a fund of almost 40 million euros to catalyze the healthcare sector. Now the issue we were having is the fluctuation in currency. But I also said that, you know, in the first, I think 7 years of implementation, the pharmaceutical sector was the biggest portfolio. So for us, if we have a structured, especially working with a group, an association, it's easier for us to support you, to support your members, right? Working capital, purchase of drugs. In fact, we actually approached one of the wholesalers some years ago saying, can we support you to support your members? But we have to at least see data around how much are you selling and all that, but they weren't willing to show that data. So we backed off because we have to see what we are funding. So again, this is also another opportunity because I know that to do business here, you need credit, you need access to finance, and the banks are not at this point willing to do that. And also to say that we're trying to remove the barriers, so it's digital. So you don't need to, if we see that you have a consistency in your operations, then of course we'll find a way to learn. But we need an association to be able to do that. So I'm very willing, and let's start the discussion because there's a lot to be done. Thank you.
Thank you.
Yes, thank you, Okapo, for bringing me up. Yes, I will take that opportunity to be the patron. But I must tell you, from day one, we decided that Pharma West Africa will not be a talk show. Establish what we call Pharma West Africa Exclusive Leaders Club. We selected 40 personalities from the industry for advocacy, for writing position papers, and we meet quarterly every 3 months. We met on Tuesday, and luckily enough, your chairman is a member, and so many of your members are members on their own right. And if I tell you, even on Sunday, we submitted a position paper to DG NAFDAC. I personally submitted to her. So we are for action. We don't joke with what is happening. We are serious, committed. That is why we established. Again, there are so many opportunities all over, and we must bring ourselves together. We must remove the idea of bringing down one another. That jealousy, that envy should go away. We should see ourselves as brothers and sisters. I was telling him, there is a consultative forum established by the Honorable Minister of Health, which we are actively involved. I asked him, is Foden around in that committee? He said no. So nobody will get you in until you push yourself. You have to blow your trumpet. If you just keep yourself in one corner, the fire is so small, and guys who wants to eat are so many. So you have to bring yourself. I know Nairobam is involved, FEMPER, PSN, and so many. And I'm so happy that the president of the Pharmaceutical Society of Nigeria is here. It is a matter of advocacy. I am a man of advocacy. I wrote a book on the power of advocacy. I know what advocacy did to me. So you have to reach out. You have to write. You have to talk on television, radio, and what have you. You have to show them that, look, I can look at you eyeball to eyeball. But if you are afraid, you think you cannot reach out. And sometimes you have to lobby. I'm so happy when Healthcare Federation of Nigeria, 1 week after their election, I saw them how they bombarded Abuja. She was in the National Assembly. She saw all the principal officers. She was in the minister's office. She was everywhere. Even PBAC, I'm sure you have not visited PBAC. PBAC is sitting on $1 billion, 1 billion euro, 250 million, and they're ready. And this beautiful young woman, she has 40 million euro, and you don't know. Please go and grab this money. You get this. Thank you.
Thank you very much.
Come over.
Ladies and gentlemen, I think our panelists, they deserve a big round of applause. Let's celebrate them. Wow, that was engaging. I would sincerely want to apologize to as many of us that have questions or suggestions that we couldn't just take openly. Please, the discussion is still open. We can always meet up with them and even all PDN members. I will let the discussion to continue so that we believe that out of this, we can achieve much more. So ladies and gentlemen, so right now officially, the panel discussion has ended and they're going to gather together to take official pictures. Please, a round of applause for them as they stand up on their feet. Please, photographer, I would like Alaji to please come forward. Ladies and gentlemen, we're honored to have in our